Hi everyone, welcome back to DxTx. It's Sahan and Safi here. Glad you guys could join us for another week. This week we're going to change it up a little bit and talk about how the emergency department works. I've had a rough few shifts over the last couple of months. It's been quite busy at our hospitals, and I've been getting a lot of questions from patients around, how long is it going to be till I'm seen? When are my tests going to be back? Why don't I know what's going on? Why aren't there beds available? When am I going to be taken upstairs? And it just prompted me to maybe provide some information in terms of how it is that the emergency department truly works. So not just specific to the emergency department, but actually from a hospital standpoint, the hospital functions like a well-oiled machine. Although some days it may seem like things have come to a grinding halt when it's really busy, for the most part, things work pretty well. And what I'm going to do is I'm going to try to explain to you from the perspective of a patient entering the hospital, looking to be seen in the emergency department, what it is that you're going to expect. Now keep in mind, I work in the Canadian healthcare system, and there are going to be obviously differences between different healthcare settings, what to expect in those settings, so I can really just speak to my own experiences in the hospitals that I've been in, although I'm sure there's going to be a lot of overlap regardless of where you go and are seen within an emergency department. The first thing is that the gatekeepers to the hospital are really the emergency medicine clinicians. So the way that you're going to get admitted to a hospital, the way that you're going to have procedures for the most part on an emergency basis is going to be through the emergency department at a particular hospital. Now as a patient, if you have a complaint, you find your steps at a doorstep, unfortunately, of an emergency department one day, what you'll typically find is once you enter the hospital, there will be a registration process. Typically, there's a volunteer who will greet you and point you towards some sort of a sign-up sheet or sign-up board or computer where you'll enter your name as well as the time which you entered. Shortly after that, you're going to be called in to be assessed by one of our triage nurses. Typically our triage nurses are kind of highly trained nurses, specifically trained to pick up different diagnoses, and they'll triage you in terms of how sick you are or are not. So if they feel that you need to be seen emergently, if they feel that you're having, for example, a heart attack or a stroke and you need to be seen immediately, it's the triage nurses that pick this up, bring this to our attention as emergency medicine clinicians, bring you directly into the department, in which case you'll be seen right away. So in the Canadian system, when things are not going well, when you have a life-threatening illness, you're going to be seen pretty quickly because triage will pick this up rather quickly. Obviously, there's cases, unfortunately, where we miss things, where patients present atypically, but for the most part, it works pretty well. In other cases, what's going to happen is you're going to get triaged a specific number. We triage patients on a scale of 1 to 5. 1 is the cases that I just told you about, a patient that needs to be seen immediately. A 5, we call it a CTAS 5, is essentially a patient who can wait for a long period of time without any real imminent risk or danger to them. If you have a higher number, it means you're actually probably less sick and can wait a longer period of time to be seen. Once you receive this number, you'll get it within that spectrum, typically between a 2 to a 5. You're going to be asked to sit in the waiting room. And depending on what number you received, you're going to typically be triaged to be seen in a specific area of the department. Now within the emergency department, we have numerous shifts. We have numerous areas that have different resource capabilities. So certain areas have more nurses because the patients are expected to be sicker in those areas. They have better equipment, different equipment to deal with sicker patients. And then there's certain areas that are created to deal with high volumes. So oftentimes in our fast track areas, so rapid assessment zones, fast track area, you might hear that when you go to an emergency department. That's typically meant to be for our ambulatory patients, the walking wounded, people who fall, who break their bones, people who get cuts or lacerations that require sutures. Those types of patients will go to the ambulatory area where there typically are more chairs, less beds to see patients. We'll typically cycle patients in and out of emergency medicine beds. Once they're seen, we'll get them to wait in the waiting area again to wait for their result. So depending on what area of the department you're in and how busy it is in that area, you're going to be waiting in the waiting room for a specific period of time. If it's a less busy day, it might be anywhere on the order of 15, 20, 30 minutes. If it's a busier day, it might be on the order of a few hours. The people that are actually responsible for you are the triage nurses, and oftentimes you might find that the triage nurses walk around triage and check in on patients who've been waiting to be seen just to make sure that their clinical status has not changed. And if it has changed, again, they bring that to our attention. Once this has been done, and once you've been triaged actually and are waiting, during that time, you actually have to be put into our computer system. So shortly after your triage, you're actually going to be called to another desk typically to be registered, and at which point you provide your medical information, your health card, your address, your contact information is verified, and once that's completed, you're formally registered into our system, where we can track all of the things that are going to happen to you during your stay. After this, you get called into the department, during which typically one of our nurses will often reassess you. We'll make sure that your clinical status has not changed, following which there will be another waiting period until you've been seen by one of our emergency medicine clinicians. This could be anywhere like from a MD, from a PA, or an NP within our departments in downtown Toronto, at which point you'll be assessed. A decision will be made to either pursue some further diagnostic testing, for example, x-rays, CT scans, ultrasounds, blood work, or if it's a very straightforward issue, there might not be any testing required. It might be as simple as, follow up with your family doctor, you're safe to go home, or it might be as simple as filling a prescription for you. Now, this is when things get a little bit tricky. So at this point, you've come in, you've registered, you've waited in the waiting room, you're now back into the department, you've waited again to be seen, you're probably frustrated because you're waiting so much, multiple people are asking you the same questions over and over again. But really, this isn't done to annoy people, it's more so done to make sure that your clinical status has not changed, because again, the emergency department is a very high risk setting. After you've been seen by one of our clinicians, if there's blood tests done or if there's CT scans and imaging done, your wait time is really out of our control. So once that blood test has been taken by our nurses and sent to our lab, the rate limiting step is going to be the lab and how quickly that blood test is processed by the lab. So oftentimes we get patients that are approaching us very regularly and asking, how long is it going to be until my blood work's back? How long is it going to be until the ultrasound's back? How long is it going to be until my CT scan is back? And I wish that some of us had a clear answer for you guys when you asked us these questions, but unfortunately we don't, because it's dependent on how busy they are at the lab, how busy our radiologists are, how many scans they're reading, how many urgent scans have come in ahead. It's totally at our point in terms of predicting a time, completely out of our hands, but I do assure you that in the emergency department, we try to get people out as fast as possible because we're so busy and because beds are so limited. So once your results are back, oftentimes within a few minutes, you'll probably be hearing from one of us to try to get you out the door if we can, because we really try to avoid having people in the department when they don't really need to be in the department. Oftentimes when you're waiting in that kind of registration phase, right after waiting to come into the department, you might find that, you're looking around the department and somebody that came in before you is getting called in to be seen. Oftentimes we get patients who come in and say, I've been waiting here for 4 hours. Everyone's come in after me. Everyone who's come in after me has been seen. And like I said, although we typically try to go by wait times and we try to deal with patients in an orderly fashion, if there is someone who is sicker than you or someone whose clinical status does change, oftentimes they'll get bumped and we'll see them sooner, which is the same thing that we will do for you and your family members if you came to the emergency department and needed urgent attention. So it's never done intentionally to hurt anyone's feelings or to make you wait longer and make you more frustrated. There's usually an explanation for this, and it's typically just because someone needs to be up triaged because something's changed and someone's deemed them a little bit less stable and requiring more urgent interventions. So at this point, you've had your lab test done, you've either been discharged home, or you've had your blood test done, your x-rays done, and you are getting reassessed by one of us. And so during this reassessment, what typically is going to happen is we're going to have to make another decision. The decision is going to be we've either found out what's going on with you or we haven't found out. And after that, the next question is, are you safe enough to go home or do you need to come to hospital for further investigations and management? Oftentimes, we'll have a shared decision-making plan with our patients. If it's a surgical issue, certainly we're going to get our surgical colleagues involved. So for example, if your ultrasound shows that you have an appendicitis, then we're often going to recommend that you come into hospital. You may need surgery, and we'll consult our general surgery service. If your ultrasounds and your blood tests are normal and you look well and you have good follow-up with your family doctor, oftentimes you'll be asked to follow up. Patients often get frustrated with us in the emergency department because a lot of the times we don't have an answer. And oftentimes what we do in the emergency department and what I explain to patients is we are better at figuring out what you do not have than what you do have. Really, our job is to make sure that there is no emergency or life-threatening diagnosis currently to explain your symptoms, meaning there's nothing that requires you to stay in hospital for surgery, there's nothing that requires you to stay in hospital for medications, there's nothing that's going to be an imminent risk to you and your life in the foreseeable future. And if we deem that really we can't find a cause for your chest pain, this doesn't look like a heart attack, your heart tests are normal, this doesn't look like a blood clot in your lungs or an infection around the heart. Once we've ruled out all of those big bad diagnoses, a lot of the times we'll say, we're not sure what your pain is. We'll try to give you an explanation. Oftentimes, it might be musculoskeletal, there might be a sprain in the chest wall, there might be some gastroesophageal reflux that's causing your symptoms, but we'll often recommend that you get reassessed through a primary care provider who can do more definitive tests and figure out exactly what it is that's causing your symptom. If we deem that you need to stay in hospital, that's usually the next question the patients have is they'll often come and say, we've been seen by the general surgery team or we've been seen by the specialists, and how long is it going to be until we get a bed upstairs? How long is it going to be until we're admitted? And really that just depends on the state of the healthcare system, on the state of the hospital system that you're in. But again, similar to when you're waiting for your tests, it's not up to us in the emergency department. None of this information is privy to us when we're seeing you in the emergency department until there is a bed available. So if we could tell you that your bed's going to be available in 2 hours, we absolutely will. But most of the time that information is not available to us until shortly before you're getting transferred upstairs. That wraps it up for today. I hope again that this was valuable information to you. Please feel free to comment and as always, I'd appreciate your support. You can always subscribe below. Please like the video, and if you have any questions or concerns, if you feel that there's any inaccuracies, please don't be shy. I look forward to reading your comments, and I look forward to seeing you again next week on DxTx. Take care.